Hi everybody. This video is a brief explanation about psoriasis. Now, what is psoriasis? This psoriasis is a chronic autoimmune condition that causes rapid buildup of skin cells. Usually, the typical life cycle of a skin cell is just 1 month. But in people with psoriasis, this production process occurs in just few days. Because of this, the skin cells don't have time to fall off. This rapid overproduction leads to the buildup of skin cells, which causes scaling on skin surface. This scaling is the most prominent symptom of psoriasis. The scaling will be whitish, silvery scales, which is the differentiation point for psoriasis. The symptoms include red patches of skin covered with thick whitish silvery scales. The next one will be small scaling spots, and then dry cracked skin which often bleeds, itching, burning, soreness, and then thickened or pitted nails, and also swollen and stiff joints. All these contribute to the symptoms of psoriasis. There is one question with everyone: is psoriasis contagious? No. Psoriasis is not contagious. You can't pass this skin condition from one person to another by just touching and using their clothes and becoming very close to people. Psoriasis doesn't spread. It is important to be educated on this question because many people think it to be contagious, and I've seen my patients avoiding these kind of people, and they are like psychologically affected due to this problem, since it is a completely appearing in a different way, and the people who react on seeing this skin condition is like very worse when I heard those sufferings from my patients. So to make it in a clear view, I'm just explaining this psoriasis is not a contagious disease. And what is the cause of this disease? The cause of psoriasis is usually not fully understood, but it is related to immune system problem that happens with T cell and other white blood cells. T cells usually travel through the body to defend against foreign substances, usually viruses and bacteria. When it enters into the body, these T cells protect us from these kind of infections. But if you have psoriasis, these T cells attack healthy skin cells by mistake. Okay, without knowingly, they attack our own body cells, which causes again the buildup of skin cells. The next cause will be genetic one. Some people usually inherit the genes as a familial condition. This gene is inherited from the family members, from our parents or their forefathers, and this genetic predisposition is usually a small cause. Only 2 to 3% of people usually replicate this genetic condition. The next part will be types of psoriasis. This plague type of psoriasis is the most common form. It has dry, raised, red skin lesions, usually covered with silvery scales. It is itchy and also painful. They occur anywhere on the body, mainly on genitals and soft tissues inside the mouth. Nail psoriasis. Nail psoriasis affect fingernails and toenails, which causes pitting and then abnormal nail growth and discoloration. This psoriatic nails gets loosened and they get separated from the nail bed. Most severe cases, this may lead to the crumbling of nails. The next type is guttate psoriasis. Guttate affects young adults and children. It is usually triggered by a bacterial infection like streptococcus infection of the throat. There is a small water drop shaped scaling lesions that appears on the trunk, arm, leg and scalp. The next one is inverse psoriasis. This affects the skin in the armpit, groin, under the breast and around the genitals. This causes smooth patches of red inflamed skin that worsen with friction that is when we do some motion, it gets worsened, and due to sweating, also it gets more worsened. Next type is pustular psoriasis. This is usually uncommon. This occurs in widespread patches or in smaller areas on your hands, feet, and fingertips. This is developing in a quicker and a pus-filled blisters that appears just hours after your skin becomes red and tender. The blisters may come and go frequently, and this pustular psoriasis causes fever, chills, severe itching, and also diarrhea. The next type is erythrodermic psoriasis. This is the least common type of psoriasis, where your entire body is covered with a red peeling rash that can itch and burn intensely. The last one will be psoriatic arthritis. In addition to the inflamed scaly skin, psoriatic patients develop swollen painful joints, which is a typical form of arthritis. There are some major complications of psoriasis. The first one will be psoriatic arthritis. As I told you earlier, this psoriatic arthritis causes loss of function in some joints, which can be more debilitating. The next condition is eye disorders. That includes conjunctivitis, blepharitis, and uveitis, which are more common in people with psoriasis. The next one will be metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes high blood pressure, elevated insulin levels, abnormal cholesterol levels, which altogether increase the risk of heart disease. Next will be Parkinson's disease, which is the neurological conditions that occur in people with psoriasis. And finally, there are some emotional problems which occur as a result of psoriasis that also affects the quality of life when associated with a low esteem and depression. Stay strong and healthy.